Hi everyone, Dr. David Kulla here with Synergy Wellness in New York City. We have a patient here that has allowed us to film, and she has osteoporosis, severe osteoporosis. She has multiple compression fractures here in her thoracic spine, has had surgery in that area. So a lot of people think, oh my God, you had back surgery, you can't get chiropractic care. That's just not true. So for those of you that want to watch what gentle chiropractic care is about, you can watch this video here. So what we did for her just now is we did some gentle traction and flexion distraction. It's called Cox flexion distraction technique. You guys have seen me do videos on this technique before, just like this. She also has, significant osteoarthritis and degenerative disc disease at the lower part of her lumbar spine, right below my hand here. And again, several compression fractures above my hand. So we need to be very careful. We're not going to adjust her the traditional way that we might adjust somebody else. So this is the importance, it shows the importance sometimes of taking x-rays on patients, and there were some red flags with her, so we knew first visit to take x-rays before we did anything, and sure enough we found osteoporosis. If she will allow me to, I'll also put her x-rays up on this video, but that we need her permission to do that. So another technique we're going to do here is Thompson technique, and you hear that this pelvic piece popped up, and it's on a hydraulic system. I can adjust the tension. And we're going to adjust the sacrum down towards the feet. And by doing that, we open up the lumbosacral joint. And when you open up that lumbosacral joint, you're taking pressure off L4, L5 nerves, which is the sciatic nerve. And she gets some pain down the side of her left leg. So this is a gentle technique, as you can see. It may look like I'm pressing hard. I am not. And I can adjust the tension here. So she cannot have traditional chiropractic care. She needs to be careful also about possibly falling as she ages and fracturing a hip. So we've got her on some supplements to help with osteoporosis. Got her on weight-bearing exercise, which also helps to reverse osteoporosis. But she's behind the game, and we need to speed the process up for her. And we also need to make sure that she's absorbing the calcium that she's taking. So there's still some work to be done on the nutritional side there. And again, this is Thompson technique mixed with Cox flexion distraction technique. Yep, and a little bit of soft tissue work here as well. She was a little bit sore in here. So we're going to loosen that glute up and that piriformis. So remember, if you have osteoporosis, you want to make sure you're doing weight-bearing exercise, that you're increasing your calcium, your magnesium. There are some other supplements. We'll go into that in the description. And, vitamin D, and there are a lot of other supplements. Everybody should be taking a multivitamin. Don't get me started on that whole tangent. But nevertheless, if you have a parent or grandparent that has osteoporosis, there is that risk of falling, breaking the hip, and that's the most common cause of death from a fracture. And it just recently happened to somebody in the media. I can't remember, the name's escaping me, but it happens a lot. So you really want to work on, as people age, their balance and their bone strength. They want healthy bone strength, right? So really important. We're a little limited with what we can do here with her because of the osteoporosis, but I'm still able to do just about everything I would do with a degenerative disc or an osteoarthritis in the lower back. This is how I would treat them. I would not put them on their side and adjust that way, which she should never have done. now or even in the future, even as her bone strength improves. So if you guys have any questions or comments about osteoporosis and whether it's safe to get chiropractic care, I think you now know the answer. Yes, it is. Thanks for tuning in. Thank you guys so much. If you got anything from this video, or even if you just like this view of the Empire State Building and the Chrysler Building, give me a like and don't forget to subscribe. Appreciate you guys.